Hello, everyone. Good afternoon. I hope everyone is doing well. So, I am Nathan Ade from the University of Derby. I am a student ambassador at the university, currently studying a master's in visual communication. And I'll be the questioner and facilitator for this exciting conversation. And so, I'll kindly ask the panel to introduce themselves, just saying their name and their role in one sentence, please.
My name's Richard Townsend. I'm a senior practitioner. I work for Derbyshire County Council.
Hello, my name's Sue Williams. I'm a senior training and education officer in Derby City Council Adult Services.
Okay, awesome. So I think that's all the introductions done. So the next thing I'd like to ask, if the panelists, if you could sum up what your role involves in no more than 3 minutes, and we'll start off with Richard and Sue. So either one of you can go first, and then we'll try and get to Sophie after that.
Sue, would you like to go first?
Okay, thank you. So I am a qualified social worker and best interest assessor, as well as being the training and education officer. So I do independent assessments of adults' mental capacity, and if they don't have the ability to decide about where they would like to live or receive any treatment they require, I make a decision in their best interests after consulting with various others and making lots of risk assessments. And the training and education officer part of my role involves me working alongside our local universities to arrange and support and assess social work student placements, and also our newly qualified social workers in practice. We support them in their assessment supported year. I facilitate those. I facilitate and mentor our apprentice social workers who are on a 3-year apprenticeship. And slightly separate from Derby City Council, I'm also employed by Social Work England, and I'm an adjudicator on their fitness to practice panels. That about sums me up. Thank you.
Thank you very much, Sue. And Richard, please.
Thanks, Nathan. I'm a senior practitioner, which is a type of social worker, so like a senior social worker. And I work in a team for Derbyshire County Council called the Enhanced Support Team. So that's our local authorities' answer to implement something called transforming care and building the right support. Now, those are government agendas which came out of something called the Winterbourne scandal, which was a famous hospital about 9 years ago, where there was some terrible abuse of people with learning disability and or autism. So it's been very much in the spotlight as a nation since. But my job in that agenda is to work with people adults who have got either learning disability or autism and must have challenging behaviour for our team for that agenda. So I work with trying to stop those people being admitted into hospitals. So that's specialist mental health and learning disability type hospitals. I'm also working to get those people out of hospital. I do a case management as well. I still work hands-on with people, so I have an active caseload, which I enjoy doing. And part of that is about doing assessments for people for adult care services. Also working with people from the age of 14 who are involved in children's services to do what's called preparation for adult work. I'm also a best interest assessor, similar to Sue, and it's very interesting part of the role to do capacity assessments, to make sure people can make their own decisions and assess whether they can or not, and also to work with people to ensure that their interests are represented. So it's a very, very varied role, and it's often working around people in multidisciplinary teams as well. So we build teams and then make sure that they work. So those teams consist of often psychiatrists, different types of nurses, intensive support teams, speech and language therapists, police, So I'll be quiet now. I could probably rattle on a bit more, but I'll leave it there, Nathan. Thank you.
Thank you very much, Sue and Richard. Sounds like you've got really important roles that, as you said, Richard, cover a wide range of scenarios. So we're going to get to an audience question. And what I'd like to ask is, what sort of personal qualities do you think you need to be a social worker? And Sophie, can we just check if your sound is working? So just say your name and your role title again, and we'll see if we have sound. I'll let you try and answer the last question before we move on, actually.
So I'm Sophie Stockton. I'm a social worker from Derbyshire Adult Care in the first response team.
Okay, awesome. Thank you. Oh, nice and sweet. Okay, nice and short. Okay, so yeah, back to the question. So what sort of personal qualities do you think you need to be a social worker? So I'll leave that open.
I think for each social worker, you have different qualities which lead to social workers having different strengths when they're in practice. I think one of the things that all social workers have in common is the genuine wish to help others. Being a good listener and conversation is important, as is being able to build a really good rapport with the people we work with, their families, and those around them, including other professionals. I think being open-minded is something that's very important. As social workers, we're often asked to look at situations where other people maybe report concerns, and we have to go in with an objective eye. Not everyone has the same benchmark when it comes to lifestyles, and we need to be mindful not to project our personal views onto other people. So I think open-mindedness is something that really is valued in social work.
Thank you. Would any of the other panelists like to add to that?
Can I come in, please, Nathan?
No problem. Okay, so the next question is mainly for Richard, and I'd like to ask, could you tell us about some of the opportunities for development or specialisation within this role?
Well, I think all three of us on this call, Nathan, are adult social workers, and I can speak about the route in adult social care. I think there are, I suppose, about my team itself is a specialism within Derbyshire Adult Care, so that's working with people with learning disabilities and autism, and underlining that agenda. Sue and I have talked about doing something called being a best interest assessor, which is working as a specialist under something called the Mental Capacity Act, which is the legislation that in this country that sits over people who can't make their own decisions. So that's about doing capacity assessments, and also making sure that people can try and make their own decisions in the first place, and then making best interest decisions, which is a whole area of specialism in itself. There's court of protection work that we do as a team in the enhanced support team. So court of protection sits over people that can't make decisions for themselves. But also, I'd say, I mean, there are job variations, but I'd say also, Nathan, that in say generic adult teams, which is where I came from before my current role, that there are lots of different specialisms within just a generic, I mean, like an adult intake team. So that there would be opportunity to work, say, with older people with dementia, for instance, and then younger people with learning disabilities. And then also something that I liked when I was in an area team, I worked with people who had problems around hoarding, and then there were people with drug and alcohol problems, and then of course mental health as well, working in mental health social work, which is a huge area all in itself. So there are specialisms within jobs, and there are niche career avenues that can follow. So it's very wide.
Thank you.
I hope that answers your question, Nathan. Thank you.
Yeah, I think that was very detailed. Sue and Sophie, would you also like to add any other specialisms or other information?
Yes, please. one of the roles that I mentioned very briefly earlier on was about social work student placements. So within all social work teams, we normally have what we call practice educators, who are social workers who've done a little bit extra training to be able to support and assess students whilst they're studying to be social workers, and they have to do a set number of days within social work and other caring profession teams. So that's another role that social workers can take on. And I know Richard very briefly mentioned some specialisms around mental health teams, and one of the additional qualifications that they can take within that is the approved mental health professional role. And that's a specialist role which gives them certain areas that they must adhere to within the Mental Health Act for people who are struggling with mental ill health. Within each team, very often workers themselves will have a special interest, and they may not have a qualification, but there may be very detailed knowledge about an area. So for example, somebody might be very clever and knowledgeable about the benefits system, or perhaps adults who have no recourse to public funds because they are from a different country. And so there's lots of little areas that you can work in, whether you have a qualification in that area or not. It's basically about your knowledge levels and your interests.
Awesome. And whilst we have your attention, Sue, I'll just go back to the previous question and just check, what would you say are some important personal qualities? I think you've started to touch on it already, but yeah, just some important qualities in social work.
Yeah, I think first and foremost, you've got to like people, because you're going to come across lots of them. So you've got to enjoy working with people. And as Sophie said, you've got to be open-minded and objective, because you can get some very clever people who may try and influence you, and you need to be able to weigh up material objectively. You've got to be honest. You've got to be respectful of other people's choices and their lifestyles, as Sophie mentioned. Sometimes we have to work as part of a team to get the best out of what's available and make the most of our resources. But also, you are a registered professional in your own right, and so you have to make professional decisions alone. So you need to be confident to work alone at times too. You will have a very varied caseload, as Richard said, and so it's a bit like spinning plates or juggling. So you perhaps need to be very well organised and manage your time very well. You need to be very clear of your role and the boundaries of your role, because you're going to be working alongside many other people, similar to the kinds of people Richard mentioned, and you can't tread on other people's toes, and you've got to be respectful that they may have different priorities to yourself. You've got to be an incredibly well communicator in lots of different arenas, and with lots of different language styles, whether that's oral, signing, pictorial, writing, whatever that might be. You've also got to have insight and perhaps understand what isn't being said in a situation, so that you can draw out people's strengths and encourage people. And part of that might actually be having some difficult conversations with some people, because what you're able to support them with and what they may expect might not be quite in alignment. So you need to be a good tactician too. I don't know if that helps. A few more pointers.
That was very interesting. Thank you. And Sue, if we could go back to this question of specialism, would you like to also add to what Sue and Richard have said in terms of other routes of specialism within social work?
So both Sue and Richard mentioned a lot of the things that, I too am a BIA, so doing those mental capacity assessments. But one of the things that hasn't been mentioned and is something in Derbyshire that we have is specialist prison social workers. So there are avenues outside of what maybe would be described as traditional adult social care. And actually in Derbyshire, we have 2 specialist social workers who work within the prison system. So there are avenues into other areas, such as the criminal justice system, that may interest people who hadn't thought that social work was for them. But there are some quite diverse roles should you get your social work degree. And I think as well, one of the things that I've managed to experience in my career is I had the opportunity to work with kind of care agencies and that side of things, care providers, as well as working with those who receive care. So I think, you know, it's quite good to know that there's quite a wide range of things available to people for a further career further down the line.
Thank you very much. So the next question I'd like to ask is a bonus one. And so could you, all three of you, tell us about a very proud moment in your career? So,
I could go first, Nathan.
Yeah, you can go.
Thank you. I'd say that often as a career that sometimes you get feedback more when things are going wrong rather than things are going well. Sometimes the feedback when things are going well is often through letters or cards, but I haven't had many of those really. But it doesn't bother me. But I remember something that I was really proud of in my career. I used to do some work with people with drug and alcohol problems, and I worked a lot with men around those issues as well. And two of those men that I worked with, I remember they sort of went, they sort of took me to one side and said, they just said thank you. They said thanks for all you're doing. And that sort of thing from those people was just you know, I was really proud of it. You know, they said, you know, you go above and beyond in your job. So that was great. Yeah, it's great feedback to get from people who wouldn't sort of give formal feedback. But yeah, it made me very proud. Thank you.
That's amazing. Sue, what about you?
The moment that I was very proud, I guess, was perhaps not a particular individual case, because I wouldn't want to break any sort of confidences and things, but I used to work in a sensory team, which was a specialist team which supported people with hearing and visual difficulties. And I became the named worker for supporting deafblind adults. And with that, I had to learn a language called Deafblind Manual. So if you can imagine someone who can't see or has very limited vision and can't hear, trying to communicate with them and supporting them to access information can be particularly problematic and quite daunting for the person themselves. So I guess a very proud moment for me was actually learning that language.
That sounds very impressive, actually. Thank you. And Sophie, what about you?
I think a lot like what Richard was saying, there's no specific moment for me that stands out as my kind of proudest moment in my career. I think for me, it's, you know, like any job, there's days that are not so good, days that are better. And the one thing that I will say continuously is no matter how bad a day I'm having, there will always be a person, whether it's a service user, a family member, or even a professional, that will kind of make the day better, because it makes me reflect on why I do the job. So, you know, even just the smallest thing of someone achieving a goal that they had set themselves and I've been some way a small part of that, makes it all worthwhile. So it's not really one moment, but I think every day there is always a little thing that makes me remember that no matter how bad a day I'm having, this was the right job for me in the end of things. So
That was a really powerful answer. Thank you. So now we're going to get to our last question. What would the next steps be for someone watching this event who might be considering this as a career? So we'll go with Sue first, and then Sophie, and then lastly Richard.
Thank you. Well, I hope from what you've heard the three of us say, you'll see what a varied career it is. For me, I think it's a fabulous career and one that I've been in for a very long time. And if today has sparked some interest, which I really hope it has, I suggest that people perhaps talk to somebody who is in the profession, find out from them what their personal experiences are, what the pitfalls may be, and how you overcome them, so that you have a really in-depth understanding of what might be a possibility. I'd also say talk to the colleges and the universities, have a look at the prospectuses to see what a range of courses there are and different entry routes into social work, because it's not just a degree at university. There are work-based supported routes as well, such as social work apprenticeships, etc. And when we talk about a degree qualification, it's not just the undergraduate route, it could be a master's degree. So if someone was perhaps a little older and already had a degree, perhaps they just got it or got it a few years ago, they may think it's not for them, but yes, they could retrain and go at a level 6 master's degree. One of the things that perhaps people don't recognise is that for any of the routes into social work, they will need functional skills level 2 in maths and English. So that's always a good one to get under your belt initially. And that can really be done free of charge. Most local places have an adult education centre where they can pick up that qualification. But that's a good foundation, shall we say, for further study as a social work trainee, whether you're doing it full-time or part-time.
Wonderful. Sophie?
I think for me, I didn't go into my social work degree straight away from school. I had a few kind of aimless years, and it took me a while to get where I wanted to be. And one of the things that helped me find my way to social work was that I actually ended up working in the care sector as a home carer, and also looking at things like volunteering. So I would definitely say to someone where it sparked an interest about social work, you can gain invaluable experience by looking at volunteering or, working in different parts of the care sector. And touching on what Sue said, it doesn't have to be about the traditional degree route at a university. There are, as Sue said, social work apprenticeships, and I know various local authorities do kind of grow your own schemes. So if you're looking at employment, and Derbyshire do have that opportunity at times so where you are employed, but you can then apply to a grow your own scheme where you're supported through your degree whilst in employment. Those kind of schemes are available. So it's worthwhile kind of making inquiries and trying to learn a bit more about those as well.
Wonderful. And lastly, Richard?
Thanks, Nathan. I don't think I can add a great deal from what has just been said, but I would encourage people to look at social work as a very interesting and rewarding career. And it's a good thing to get up for in the morning. There are some practical things about why social work should be considered, because it's a good fit with family life. If you're at that stage of your life, it's got good career stability. You'll never get furloughed. There's good progression. People are generally interested in what you do as a career. So I would encourage people to think about it. I also, similar to Sophie, I took a circuitous route into my current job. So I started out working in residential establishments with adults with mental health problems, and it was a great route into the work that I do today. So there are many routes in, and I would encourage people to join our profession. Thanks, Nathan.
Wow, awesome. So Sue, Sophie, Richard, thank you so much for your time and the knowledge that you've shared in this short amount of time that we've had.